Look, I'd just like to start off by saying that obviously the Omicron virus continues to be somewhat challenging. It's very transmissible. As the Premier said, so far it hasn't been causing the level of anxiety medically that previous variants did, but we're on high alert. Government's on high alert. I think the community should be on high alert. We don't know yet. It's too early. No one in the world knows yet exactly what the implications of Omicron will be. So this precautionary steps that the government has announced today, some are commencing, particularly the mask wearing tonight, just after midnight, and others commencing on the day after Boxing Day, are just sensible, modest changes. But I think they do indicate to the community that everybody needs to be on this journey with us, and we need to be careful. This press conference is taking place outside in the fresh air. Anything you can do over the next few days, if you're having some people around to your house, try and do it out in the balcony or out in the backyard, or if you can't do that, open all the windows, because what we do know is that Omicron's not terribly successful when it's out in the fresh air. It tends to get us when we're inside in closed environments, so be very cautious. Obviously the testing is a bit of an issue for us because, as the Premier said, very high testing. I mean, go back 22 months, we were excited when we were up around about 40,000 tests. We're now 4 times that amount, 160,000 tests. But it really is sucking the energy out of all of the frontline pathology workers, the people who are doing it, people who are doing the tests, people who are then doing the pathology examinations in the laboratories, the administration, people who are sending the details out. So I would ask everybody just to listen very carefully to the message that if you don't need to go, if you haven't got symptoms or you haven't received a message telling you that you must have a PCR test, probably you don't need to have a PCR test. And certainly if you're going visiting over the next few days, please don't go out and just grab a PCR test for the sake of it, because next time when you do need a PCR test, seriously, you may not be able to get it because if too many people just go out and use our pathology system to that extent. So if you're going to go and see, Nan and Pop or your friends and you feel like that you need to get it checked, use a rapid antigen test. Rapid antigen testing is not quite as accurate as PCR tests, but they are certainly very good for the purpose of if you're going to go and do a visit. We're here today, of course, with the Chief Health Officer, who has given us advice about the range of issues, and they are challenging issues to do with Omicron. But we're also here with the Acting Commissioner, Dave Dutton, from Ambulance. It's very frustrating for me as Health Minister to have heard that ambulances are being called out at a time when we are so busy dealing with Omicron. Our hospitals and our frontline staff are so busy that people are still thinking that ambulances are for something other than emergencies. They're not. Ambulances here for emergencies. Now, Dr. Chant would tell you, and all other doctors would tell you, if you're having some sort of serious issue, you've got chest pain or something, well, call an ambulance. If you need a Band-Aid, don't call an ambulance. And yet we're actually seeing people still doing that sort of thing, and I'm sure Acting Commissioner Dutton will fill us in on that. The other thing we're seeing is because of the long waits for the queues perhaps, and because it's the time of the year when everybody's out a bit frustrated, looking forward to fabulous Christmas, but also the pressures as it leads up to it, we're actually having health staff who've given up their time. They're not on holidays, they're working, and yet they're being abused. All across the state, they are being abused. I cannot tell you that how unfortunate that is, but also very disappointing, I think, for the broader community to hear that. Please do not abuse staff who are there to help you. Now, on the booster side of things, what we do know is that boosters are certainly helping boost your immune system. So if you're eligible, make sure you go and get it. I was really quite disturbed to hear that we had vacancies for 35,000 people just in the last few days, and they weren't taken up. I would strongly suggest that people get on to, if you're eligible, get on to nsw.gov.au, our old and trusty website, and book in. Get yourself a booster if you're eligible, because we do know that particularly for older people and those who had AstraZeneca, whilst it was fabulous for the time, it does have its challenges now and its waning effect on immunity, so we need to get a booster. I was one of those. I went and got mine a couple of weeks ago, and I think everybody should. If you've had the AZ and you're eligible, go and get it. I also just want to point out that we've had quite an increase in the bookings. Only 2 weeks ago we had 15,000 bookings. Last week we had 61,000. So the New South Wales Health Team have really stepped up because the community have come in and are actually getting the testing. But there's, as I said, there's spaces, and we need you to get out there and do that.